I'm Dr. Tiana Seetzy from RejuvenationMD, and today we are doing a PDO breast lift. So we are using polydioxanone threads to lift the breasts. There's no downtime, which is wonderful. There's really, minimal discomfort during the procedure, but afterwards, you're just sore for a couple days, nothing like a surgical breast lift. So I'll show you how simple the procedure is, and or our patient will explain just how simple the procedure is. I have my secret needle or pilot needle. I've already done some lidocaine injection here. So can you feel here?
No.
Okay, great. So a little, oh, great. And we are going to go ahead and start. The number of threads we need depends on the size breast. Bring this shoulder kind of down a little. Yeah, there we go. I might lower your head too. We'll see here. There we go. Are you doing okay? Okay, great. Me too. It's like I don't even feel it. All right. Here we are. All right, that's one. So, like I said earlier, these are made of polydioxanone, which is the same material used in surgeries. And so these are very safe. I haven't seen any true allergic reactions to any of the threads. There are multiple different size threads. The ones we use for the breasts are the largest of them. They dissolve over the course of 2 years. And during the entire time, they are making you make collagen, which is great. You okay there?
Yes, thank you.
Awesome. All right. So I'm gonna come on out here. Excellent. We're gonna go lateral now. I always say I can't predict how much lift you're gonna get from these. So if there is a specific amount of lift that you want, then I tell people go get a surgical breast lift because they can predict or see it as they're doing it. But these, I can do the best I can, and they can pull up the most they can, and you hope they do what you want them to do. It really has to do with the number of threads too. You know, if you put one thread in, you're not going to get much lift. So I traditionally use anywhere from 5 to 10 per breast. And today we're doing 5. All right there. Good job. One more. Awesome. And let's try and get it down as far as possible. And I always tell people, don't jiggle your breasts after this procedure. So do not decide, just like for your face, do not decide you're going to go run a marathon. You're not going to do a new aerobics routine. You're just going to let the threads just work. And although you can see an immediate lift, a lot of times people have some swelling to start. So you may not see it initially right this moment, but you give it some time. As the collagen forms, it'll help pull up. So that was the entire side. Okay, so let's clip the ends. Oh, here we go, there. And let's go here. And let's go there. These threads are also antibacterial, which is great.
Yes.
So they don't, they tend to repel bacteria, so low likelihood of infection. With that being said, I would not decide to go swimming in a lake with all sorts of organisms. There we go. Perfect. Let's go. Boom, boom, boom. Boom, boom, boom. We are number 1. Some people combine this with PRP as well, which is platelet-rich plasma, that vampire breast lift. Some people combine this with Scarlet, which is microneedling and radiofrequency to help with the skin texture and tissue. And some people just do it by itself. So all different ways to do things nowadays. So many options. Okay, got it. You okay?
Thank you.
Okay, good job. Almost there.
Alrighty.
Here we go. Is it hurting going in or anything?
It's okay. Right now it's okay. Mm-hmm.
And like I might have said this earlier, I usually recommend people wearing double sports bras.
Oh,
It just kind of helps keep them high and tight.
okay.
You know, it gives extra support. It feels good. It doesn't hurt them. So I think it just kind of helps keep everything nice and together. Oh, you got it. Yeah, there's really, as I kind of implied before, there's really no limit for the amount of threads that you can put in anywhere. So it's just about the effect. I'm going to put the amount of threads, it's going to give you the effect that you are looking for. There we go. And just one more. Yay. To you. You've got this. You've got it. You want to go a little bit more there. Yep. Cool. Awesome. Awesome. Let's pull it out. There we are. Good job. You're doing great. And now we just have to cut off the ends. So let's pull. Pull and push and pull and push. And you might feel like little zingers, I call them.
Uh-huh.
That's
Okay.
normal. And they'll go away.
Okay. That's good.
If you want to, you can rub them. You always want to rub up.
Okay,
If you
yes.
feel like you need to, never pull any of your tissue down, whether it's your face, your arms, your knees, your boobs, everything upwards.
Hear that.
We want it to be upwards. Fight the gravity. Fight the gravity.
Fight.
Yeah, beautiful. Yeah, I'm going to cut these off now, and then you'll be all done. Super simple. You okay? This is the easiest part of the whole thing, right?
Yes, I love the sound of that.
You know, you're getting closer and closer to the end.
Yes.
All right, let's just tuck those right under there. Oh. Let's see. I know you don't have a bruise. There's nothing. That little white area, there's a little white area on your skin. That's
Okay.
just from the lidocaine.
Oh, okay.
And that'll go away in about an hour.
Alrighty.
So, great job.